Welcome. This is Brian Wood, Medical Director for the Mountain West AETC Project Echo Telehealth Program. Each of our weekly sessions starts with a short talk focused on issues relevant to HIV clinical medicine. The following talk was recorded live here at University of Washington. We will now take you to this week's talk.
Thanks so much. This talk is less a didactic and more just a FYI of things that we're working on at the University of Washington with some of our community partners, as well as there will be an ask, maybe, of some of you towards the end. So, always my disclosures is that we currently only have FTC-TDF, FTC-TF, and CAB injections that are approved by the U.S. Food and Drug Administration and only for use in some ways and not in all populations, and that it is conceivable that we might talk about some non-FDA approved uses. The regular disclaimer. The data consideration slide, that when we talk about data, it's a limited perspective of the systemic, social, and economic factors and how they impact health. And we recognize that racism and not race creates and perpetuates many of the health disparities that we'll mention. So, I was trying to come up, most of my slides are going to be more images than words. And I was trying to come up with an image for you to look at that shows why there's still need to talk about PrEP or HIV pre-exposure prophylaxis. And I thought this was the best. This comes from the Centers for Disease Control and Prevention. Their data that in 2021, that many of the people who are at risk for HIV and who are eligible for PrEP were not actually prescribed it. And there continues to be a large disparity by race ethnicity of who is being prescribed PrEP. So we continue to have lots of work to do. We can talk about what the CDC eligibility means and what the denominator really is. But I think everybody accepts that there are people still getting HIV in this country and around the world, and we need to do a better job of getting PrEP in the hands of people who could benefit the most. And there are lots of ways that people are thinking about doing that, making PrEP easier. Obviously, injection makes it easier for people who have challenges with adherence. There's lots of work that is in progress to make PrEP easier. There are clinical structural barriers that people are addressing, bringing PrEP to people, their van delivery, things like that. But I'm going to tell you a little bit about pharmacy-based PrEP, pharmacy-delivered PrEP. And we are lucky to be here in the state of Washington that we have Kelly Ross Pharmacy. I don't know if those folks are joining us on today's call, but as you all have heard, if you've been here, that you know that Elise Tung at the Kelly Ross Pharmacy started the one-step PrEP clinic in March of 2015, so nearly a decade ago. And I know that she has presented her data both from the original sort of barriers to startup as well as implementation of teleprep. And after her success, there has been a move across the country and across the globe towards pharmacy implementation of PrEP, where the idea is that you don't necessarily have a prescriber, a doctor, a PA, a nurse practitioner, someone who is licensed to prescribe. All you have is, and it's not only what you have pharmacists. Pharmacists are very important. You have pharmacists who are dispensing PrEP without a prescriber there in the clinic. And so why might pharmacies and pharmacists have the potential to expand our PrEP access? And this figure that I'm showing here. So first, up in the right is the photograph of all of the staff at the one-step PrEP clinic. The figure, or the schematic, comes from Katrina Ortblatt and her work in doing pharmacy-based PrEP in Kenya. But I think many of the issues are the same. And so one thing about pharmacy-based PrEP is that pharmacies are ubiquitous. They are in many more places than particularly our HIV specialty or PrEP specialty offices. And people can go into a pharmacy and no one was going to know that they are specifically there for an HIV-related indication. So there's less stigma associated with pharmacy-based PrEP because pharmacies are everywhere. They're easier to get to. You probably have one in your community, no matter where you are, even if you're rural. And so that decreases time, which is money, really. Time is money. And then there are also sort of provider level issues that pharmacists already are dispensing these medications. They know all about medicines. They know all about medicine side effects. They know all about medicine interactions. And so the knowledge is there, at least on one part of the PrEP delivery system. Obviously, the ultimate goal in this is, again, get PrEP into the hands of more people who need it and have them have decreased risk of HIV acquisition and decreased new cases of HIV across the globe. This that I'm showing you here on the slide is the states in the United States where there have been laws that give pharmacists the authority to actually provide PrEP or PEP without a physician's office. And I thought it was really interesting. I did not expect Washington State, given the history of Kelly Ross, to not have these laws. And the challenge with a map like this is that it's obviously legal for pharmacists to be dispensing PrEP, except it's done under what we call a collaborative drug therapy agreement, or CDTA, where there is a pharmacist, there is a physician who is backing up the pharmacy, and the pharmacy has to be doing things by protocol. The other thing that this map shows you is that it's unfortunately not uniform what laws there are and whether there are laws. And the other thing that's sort of pretty obvious is that if you look at the southeast of the United States, where HIV disparity is greatest, highest number of cases per population, that none of those states have these laws. So there's a lot of work to be done in sort of navigating each of these state-based systems to try to expand pharmacy-based PrEP. The other thing that's sort of been really interesting is that the national HIV/AIDS strategy for the last year and coming few years actually specifically calls out the pharmacist's role in HIV prevention and care. I'm not going to read this to you, but you can go to the new HIV strategy and read about the importance of pharmacists and the role that they're going to play. But this part in the National HIV/AIDS strategy is one of the reasons why the new Ending the HIV Epidemic, or EHE, related funding, there exists a part that is specific for pharmacy-based PrEP. And there was a call earlier this year, I will say, for work to be done as part of supplements to other NIH and CDC-funded projects, supplements to work on helping expand the pharmacy workforce. And I applied, I applied for a project that was associated with the UW Birch Center. I can't remember off the top of my head what Birch stands for, but we received a supplement that we are just starting now to do work to, again, try to expand the network of pharmacy-based PrEP clinics across the country. So it has two aims, and I'm going to tell you just a little bit about our project now. The first is to establish an online virtual community of practices for pharmacists and pharmacy staff to increase their knowledge, capabilities, and comfort in prescribing PrEP and setting up these pharmacy-based PrEP clinics. And then two, to work with what's been done and what's currently in process to outline a comprehensive PrEP curriculum for pharmacists, technicians, and students. And we're going to be building on work that was done over the last few years as a collaboration with the Mountain West AIDS Education and Training Center, the Washington State Department of Health, and Public Health Seattle-King County in what was the PIPAR, P-I-P-A-R project, as well as I know that David Spock and the work with the National HIV Curriculum and PrEP curriculum are doing some of this work also. So we will be trying to work in collaboration with all of these groups. You may be wondering, what is a community of practice? Well, ECHO, our family, is a virtual community of practice. I couldn't find, Brian, a nice ECHO schematic for our ECHO. This, I can't remember which one of the UW ECHOs this is, but this is not HIV ECHO. But it really is a nice example of how ECHO exists to bring together individual providers and groups of providers into the community, to bring you into this fold and to talk with medical providers and everybody else in our HIV family to try and support and develop this community. So ECHO is a virtual community of practice. And in general, communities of practice exist to unite folks with common interests or purpose so that you can share knowledge and learn from each other, develop skills so that we can become better at what we do, and reduce the isolation that some folks may have if you're out in rural communities without the same expertise that we might have here at the University of Washington. There are physical communities of practice, as well as, obviously, though, since the pandemic, greater numbers of virtual communities of practice, and then an online virtual community of practice, specifically having folks who are online at the time. And I always describe this as a Facebook group, like my Bad Mom Docs Facebook group, where people can join a group of folks who are like them, ask questions, learn from each other. Maybe there are sort of from the top down, there are some organized themes that we're trying to teach people, but it's really about establishing a community and learning from each other. And the goal for our project is to cultivate a dense and very supportive network of pharmacy champions who are interested in the sustainable expansion of pharmacy-based PrEP across the United States. I'd encourage you, if you are a Bad Mom Doc, to join this group. It's a very good group, as an aside. So going back to my project, our two objectives are, one, to recruit pharmacists and pharmacy staff so that they can become champion members and provide support and education. And then ultimately to help pharmacists and pharmacies to implement pharmacy-based PrEP clinics using evidence-based guidelines and increasing the number of folks on PrEP. Our supplement is fairly short, and so we're not going to be able to probably see clinics go from start to finish. But our goal is to sort of help bring people into the fold so that they might learn more, decide whether they're going to pursue this. Maybe if folks are, and these pharmacists are independent pharmacies and they're already halfway there, to help get them over that finish line, so to speak, so that they can actually implement these clinics. But the goal of this is to start and to develop this new network. So again, we're just sort of trying to release the funding. So we are in the process of selecting the platform. It's probably going to be on Slack because it allows many of the same things that Facebook group does, but in a more secure way. Identify what some of the components are that are going to be critical, and then recruiting some of the initial pharmacists who are interested in learning and sharing from each other. As part of that, we'll be creating guidelines and rules of conduct, how questions should be answered, obviously being nice to each other and respectful, not sharing individual patient level information, and then trying to come up with a plan for what our goals are going to be from the research perspective of creating these forum discussions and questions, which will be analyzed qualitatively. And then Elise Tung is a partner in this project and will be holding Zoom calls, which has been something that has been a demand on her time since she started her project in 2015. And then ultimately, there's a plan for expansion and refinement and this feedback loop. And we're hoping that this group continues well beyond our funding, which will go through 2025. Our second aim I'm not going to talk about as much, which is just about outlining this comprehensive curriculum. My goal is not to develop a PrEP curriculum itself, but to identify where the parts are that we can draw from and link people to. So obviously the National PrEP curriculum is going to be something that we'll be relying on heavily, the PIPER project, as I mentioned before. But there have been some gaps that we've identified that people have asked for. One is to simplify everything, make things just checklists and frequent asked questions. Assistant for pharmacists, how to identify patients who are coming into their pharmacies who may be appropriate for PrEP. And some of those examples might be folks seeking emergency contraception, someone who's getting chlamydia treatment, such like that. Pharmacists, through the sort of results of the PIPER, we've recognized that we need to do better at training pharmacists in cultural competency and talking about sexual health, as well as training in how to do outreach, which they've never done before. And one of the things that I've heard Elise talk about as result that led to her success is the recruitment from Grindr and advertising on Grindr for their program, which is something that most pharmacists probably have not done in the past. So I'm going to wrap myself up, and I would just love if people want to reach out to me I know we have a few pharmacists in our community, but if you are providers working with pharmacists who are interested in this, I would love if you would either be interested in joining our forum, even as an expert, to share in the discussion, or to learn more about prescribing PrEP. So I would love to hear more. I'm happy to answer questions about this project. And that is my last slide. I will stop sharing.
Thank you for watching this edition of the Mountain West AETC Project Echo Didactic Series. If you like this talk, please click the red subscribe button and please check out other talks in our series. Until next time, this is Brian Wood, Medical Director, signing off.